Hey y'all, hey y'all, hey y'all. It's your girl Shema Ladd here on Help Me Out. I'm back. What? Welcome, welcome, welcome. Okay, this is the last video of this little short little series on healthcare. Okay, and we're gonna just wrap it up with this one. Okay, the first video we did was on women. You can go check that one out. The next one we did was on men. Feel free to go check that out. And this one is just a conclusion of the overview. Okay, so I want to debunk some myths. About healthcare and medical professionals. Okay, so we all trust and believe that hopefully our doctors know what they're talking about. How do we pick the right doctor? How do we know we have a good doctor? How do we know this is a good facility? How do we know they're not hiding anything? How do we know? How do we know? Right? Well, you always have your obvious, which is Google research. You know, you research the facilities, you research the doctors, you research the reviews, were there any complaints, are they mostly good, are they mostly bad, how many lawsuits, or have they been in lawsuits, what was the lawsuits for? You know, you log in, you go check on their license. You know, do they have any holdings, you know, on their license? Has there any suspensions, you know, on their license? Have they had to be re-educated on some things? You know, how do you know these things? You know, so just to dive in, many people do trust their doctor because they don't have the body of knowledge that medical professionals have, right? So you kind of have to trust us that we know what we're saying. You know, you kind of have to trust us, especially when you're sick and you can't even get up to go use the restroom yourself, or you can't even open your mouth to speak because, you know, your voice is gone, or you have a trach now. You came in, you left the house normal, and now you wake up and you have a trach and you have a feeding tube, and, you know, whatever's going on with you, right? So you're dependent on us. You're dependent on first responders, right? And you're hoping that the first responder you get has compassion and that they're actually going to pay attention to you and not just look at you as you're another body, right? Okay. So, one, it's hard to know after you've done all the research. That's the obvious, which is looking at reviews and Google researching and all of that kind of stuff, and word of mouth. You're talking to people in the community, people around town, and you do your homework, right? After you've done all of that and you're faced with a decision. Say you have to have a major surgery, but you just don't know if it's needed. You just don't know if you have to. You just don't know if there's another way. Have they told you everything? Some of you will go get a second opinion. I recommend. Some of you will get a third opinion. I recommend. And some of you won't go get another opinion at all. I do not recommend. But if you decide not to go get another opinion at all, I would at least encourage you to contact me for a consultation to discuss the options, and maybe I can help you broaden your view or understanding on some things that you may not be aware of. And so you can contact me for a nursing consultation, and you can reach out to me on this video, shoot a message, or go to my website, futuremepro.com, click on the contact me page and contact me. Shoot me an email and we'll set you up for a consultation, and we'll discuss options, consents, or other things that you may not be aware of. And your doctor may have told you everything that's correct, and it may be, I don't have anything else to say. He did a good job. She did a good job. She's leading you right. She's telling you right. And then you have at least confidence that, okay, my doctor is okay, you know. And it may be, I may say, you need another opinion, Get a second opinion. Get a third opinion. You know. And I'll give you some resources on some other things just to bridge in some gaps so you have more confidence when you're going into a major surgical procedure, or a medication change, or whatever's going on with you. Okay? But to debunk, I'll tell you a few stories. Okay? So first of all, my knowledge, I've been a licensed vocational nurse for 15 years now. Okay. I started off in the BSN program, which is a Bachelor's of Science of Nursing at the University of Texas. And so I took a couple of semesters there, and I realized there's something I'm missing. I'm not feeling nursey. It was all more book knowledge. So I withdrew and I went to TCC in East Texas, TVCC, and got my licensed vocational nurse. And that's where I found all my good stuff. That's where all my skills was, working with all the machines, working with the body parts. That's where all my good stuff was. That's like when my mind clicking, ooh, you know. So after that, I went back and did my RN with Excelsior College up in Albany, New York. And so I finished that, but I never went back to do my state exam or my clinical exam. So those are the only 2 exams, and that's not hard to pass because I passed it before. And so then I will be a licensed RN. But I'm not a licensed RN because I did not go back and take my state exam. I opened and started my business as an LVN, and I was making so much money, I didn't feel the need to do RN because I didn't have plans on working in a hospital. I had plans on financial freedom. So, but I am still a nurse. I'm still very active. So I was in surgery with a couple of doctors doing a hysterectomy on a woman, and one doctor was real calm, older doctor. One doctor was a newer doctor, a little energetic and high strung. And so the presiding doctor, which was the older doctor, the veteran doctor, he was there more so to support the newer doctor. Now, the newer doctor had been a doctor maybe for 4 years maybe. And so I'm monitoring my patient, I'm watching, and this doctor was so high strung. He was doing his job, but his hands and his strategy was just like him, high strung. So he ended up hitting a major artery in her pelvic area. And you knew it was not good when the presiding veteran physician was like, "Ooh." And so this lady's locked out, and I'm watching him try to cauterize this artery to get it to stop bleeding. And they couldn't get it cauterized. They couldn't get it to stop bleeding. And this was going on for about 30 minutes or more. And so the veteran physician had, to take over, and they eventually got it stopped. But it was his high strungness that had made it happen in the first place, right? And so through doing surgeries with doctors, being in the OR, and because I am into personal development, and I've always been as a child, I've always monitored behaviors, why people think the way they think, why they made the choice and decision they make, why I've always been that way. So what I've come to learn, and many other nurses will confirm this, people are people. It doesn't matter if you're an attorney, if you are a doctor, if you are a nurse, if you are an auto mechanic, if you are a school teacher. Whatever you are, people are people. You're always going to have your good, bad, and your ugly. You're going to have people that are working that job just because they need money and they have to get a job. You're going to have people working that job because that's truly who they are. If you put them somewhere else, they're still going to do that thing because that's just who they are. Okay? You have people that are going to do things purposely, make mistakes, and then lie about it and try to cover it up because they're just a rotten person. Good, bad, and ugly. Doesn't matter your occupation. Can I leave it there and say, let's say it? Okay? So when you're picking a physician, when I pick a physician, especially when I know that's going to be operating on me, I take my time doing my consultations and my research because I like to meet them in person, because I understand how they move in person in front of me is how they're going to move on the operating table. So the older physician, he was very gentle. He takes his time with things because he's older. He just, want to make things done right. He's not too hungry for money. He's been doing this a while. He took his time with it. I know that's how he's going to be on the operating table. I had a physician, when I got my hysterectomy done, I had never been in surgery with him before. I knew I was in pain, but I also knew he did a good job. But I didn't see what he did to me while I was under. So once I started going to nursing school, I think at this point I was at UT, and I actually ended up being in the surgical room with him. He was delivering a baby C-section. He was delivering a baby. Was it delivering a baby C-section? I believe he was delivering a baby C-section. It wasn't a hysterectomy. I believe he was delivering a baby C-section. But I watched him, how he handled her organs, how he handled her body. And he handled it the same way he does when I'm in an office visit with him. How he moves, how he maneuvers. He's very firm. He gets it done right, but he's not overly firm where he messes some stuff up. He has manly hands, and the type of man he is, he was the same way in surgery. So I was able to see how he handled my body. He handled my body the same way he does when we in an office visit together. So that is one tip for you guys. When you're trying to select a doctor, you're trying to figure out who and how. If he's super cool and he like, yeah, I'm cool. Oh, yeah, man, come on. Woo, 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 woo. Yeah, we doing this thing. That's how he's going to be on surgery table. And if you're comfortable with that and you still have confidence with that, go for it. You're all good. If you're not confident because he may be too cool and overlooked something, then you want to second guess that. He may be a cool doctor in the office visit. He may give you everything you want, your prescriptions, your referrals, whatever. Super cool in the office. You want super cool in the surgery room. That's a personal choice. And that has to go off of your trust level with that. Okay? Same thing with nurses. When your nurse comes in and she's talking to you and does she ask you questions real fast while her back is turned to you the whole time? Turn around, come look at the machine, do you need anything, and walk out? Or when she comes in, does she ask you, how you feeling today? Do you know where you are? What's your name? What's your date of birth? What do you feel like eating today? Oh, is your family coming? Okay, I'm just going to check this out. I'm just going to make sure. How's your pain level? I'm just going to make sure. Oh, okay. How was your experience versus the first one versus the second one? The first nurse, is that the nurse you want in the OR with you? Okay. Now, I said there are sometimes you can request a nurse to be in the OR with you. Now, this is not information that every patient knows. Every patient doesn't know this. I'm just sharing this with you because I know. And it's something that I would do because I push barriers and I want what I want. Okay. But you guys, yeah, there are certain nurses, and we can do that on the other side, because if there's doctors that I vibe with, I'm like, hey, can you do this for me? I'm having a procedure. I really want you to do this. I really want, you might see that on Grey's Anatomy or ER, where, the co-workers, we do things for each other. We do procedures for each other. We do these things, right? But as a patient with your physician, if you have a nurse that you really like, and it's a nurse that's in your doctor's office, maybe it's a particular RN, you can ask your doctor that. Well, hey, doctor, I know the hospital has their staff, but is there any way that your nurse, RN nurse, can be in the surgery and float and monitor? And at that point, it's up to your doctor to decide or the hospital, if they want to pay her to do that. And if they agree on that, then you get the nurses and the staff that you want in your operating procedure. Okay? So there's nothing wrong with requesting the nurse that you want or the team that you want during your surgery. If you're going to get it, if they'll approve that or not, that's a whole nother subject. But you have a pretty good chance that they will. Okay? So yeah, that's one of the biggest things. Another thing, people esteem RNs over LVNs because they think if you're a RN, and it's a North American society, it's a world society thing that they have placed on that, because LVN is supposed to be the beginning stage, then RN is the next stage, and then you get your BSN, which is your bachelor's in science, and then you get your MSN, your master's in science, and that's where you have the nurse practitioners, and then from there you go into a doctor. Okay, so I'm going to demystify the myth between RNs and LVNs, and this might be a hard one to swallow for some of you, but it's the straight up truth, and it will help you in protecting your health care and making your decisions. Hear me when I say this. Okay, I've been through all three programs, LVN, RN, and BSN. My BSN was already set to fast track to my MSN, and I was going to do education and masters. So I was already set on fast track for my MSN, right? So on the LVN and the RN, people think LVNs, and this is a societal thing because I've dealt with it and I've seen it, and I was guilty of it before I became a nurse because I didn't know. I thought the same thing the rest of society thinks. RNs are the best nurses. And I literally just had to explain this to someone last week, because you guys also know I'm an actress. And so I also have an acting gig with a school called Pearson, and they teach PAs, physician's assistants. And so I go in as an acting patient, and I give them real life scenarios to help prepare physician assistants so they can go out and assist the doctors and the physicians. So, okay, so I'm going to tell you a story on that. So please hear me if you don't hear anything, because you probably won't hear this spoken anywhere else. I'm telling you a straight up truth. You probably won't hear this spoken anywhere else. So you want to share this video with as many people as you can, because I'm about to demystify some myths when it comes to healthcare, so you truly understand what's going on and why some things don't make sense to you when you go to hospitals and places with medical staff. Okay, so LVNs and RNs, they're basically the same. It's only like maybe 5 differences between them, maybe, and they're not even big differences, literally. But society thinks RNs are the best nurses. Keep in mind, people are people. Don't care if you are RN. Keep that in mind. People are people. Don't care if you're RN. Okay. I'm an LVN. I have ran circles around RNs. I am an LVN. I have seen RNs make incorrect nursing diagnosis. Okay, we're going to start with the schools. All nursing schools, medical schools are not the same. All nursing schools are not the same. When I was married, I went to a nursing school for LVN. My sister-in-law went to a nursing school. I went in East Texas and Palestine. She went in Dallas. My education from my nursing school was so much further above the education she received. My education prepped me to be a RN. I already was going to hospitals doing blood draws. I was already doing pre-op, prepping hep locks in my patients, connecting them to their IV fluids as an LVN student. I did everything an RN would be doing as an LVN student. I was prepped to automatically go and win and pass my RN already, off the top. My sister-in-law, she didn't get any skills on IV. Zero skills on IV, and she's an LVN. How could this be? How could this be? The curriculum. How could this be? I will let you guys do that research on your own, but I want you to know all nursing schools and programs do not teach the same thing. All of them do not prep. And that's why when people search for colleges, why do people look for colleges? Why do they do college tours? You want to see which one is going to offer you the best education and set you up for the best possible success. All colleges won't do that. They're geared to do that, but do all of them do that? Same thing with medical school and nursing schools. So I chose a nursing school, and this is why I'm not going to say I'm better than anybody. I'm not, but I'm better prepared. So my school, TVCC, is so known around the state of Texas that any hospital, any school, they will accept a student. If you say you came from TVCC, they will take you because they know what kind of training we got. I had nursing teachers that were at the Board of Nursing, Texas Board of Nursing. They would go and visit and give their 2 cents. They were very active in the Board of Nursing. So the group of teachers that I had, they encourage us to be active with the Board of Nursing. They encourage us to lead and be advocates for our profession. So having a group of women teachers that were very active in the Texas Board of Nursing, actually training our school and our class, we came from the top notch of LVNs. So even though Dallas was bigger, Houston is bigger, TVCC is what rocks in Texas when it comes to LVNs. That's the school I attended. I was prepared, and my sister-in-law was not. So that's one portion of it, okay? The next portion, RNs. There's different ways to become an RN. Like when I went to UT for my BSN, a RN is an RN regardless. If you have a bachelor's, you're an RN. If you have a master's, you're an RN. You don't become more than an RN until you hit a doctor. So it's bachelor's RN, master's RN, doctorate, nurse doctorate. Okay? So that's how that goes. It's LVN, associates, bachelor's RN, master's RN, doctorate, doctor. That's how that goes. Okay. LVN is the lowest on the scale, but I went to the best school. my education is more and I'm better prepared than the majority of the rest of the LVNs. Okay. And this is just Texas, but I can tell you my experience in Las Vegas and Nevada as well. The things that I saw when I had to document and go behind other nurses' work, it was below par. And when I asked the managers and the founders of certain companies why, they all said, well, these are all nurses that came from California. That was their response to me. So what does that tell you about the education of California nurses? And I'm not banging or bashing California nurses or any other state nurses. This is strictly about education and programming, teaching, and advocacy for the patient. That's strictly what this video is. But this is also me letting you know what the questions I asked and what I was told, what they were saying, and why I was spotting so many mistakes. Why is this? I sat in an orientation with a girl. We were doing medication calculations. And the instructor asked a simple question. It was something like, if you have a 200 milligram tab and you the doctor orders you give a half a tab, how many milligrams would be left, or something like that? You only got to split one tab. She didn't know the answer. She didn't know the answer. If each tab is 100 milligrams and you split one, that means you only have 50 milligrams. You're giving the patient 50 milligrams and you have 150 left. She couldn't figure that out. They figured out a way to help her with that so that she can be hired and go work with the patient. And I just sat there looking like, who patient is she finna be nursing? And this is nurses, and this is not nothing I'm lying about. If you ask other nurses, we've all been in a room where we've seen nurses like that. It starts with the schools. I was in school with a girl. We were learning how to give injections. She opened her package. The whole nail went through her finger and her fingernail. She had a whole needle sticking through her nail. Now that one, the nurse, the instructor did pull it out of her finger, and she couldn't finish the course. She couldn't finish the nursing course. She was let go. But then we were in hospital and clinic, and this man had a Foley catheter, and the nurse, she was happy-go-lucky. Remember I told you, it don't matter who you are, RN, doctor, she was on happy-go-lucky. She just moving around, tripped over the man Foley, damn near, excuse my language, pulled it out, and the man started hollering, but they allowed her to stay in school. They did not expel her. Maybe because the one who stuck the needle through her finger was black, they let her go. But the girl who tripped over the Foley and caused the patient pain, which is an ethical issue, they kept her. She was white. And I'm not making this racial. I'm just saying what I saw. Okay. So, and the teachers, instructors, they will try to work with the students. But there are some people who should not be passing a class. They should not be passing the nursing program. They shouldn't. And some people, they'll keep you because, like the good old boy system, oh, we're the same color. Oh, I just like you so much. I'm going to help you make it. But they should never been a nurse. They'll make it all the way up to RN. And them the ones I'm running circles around. And they have incorrect nursing diagnosis. But because they've built a little clique of friends, because they're so friendly and caring and giving and generous and kind and humble, and they get to keep the job. Which means the patients that come in, I'm sharing this video so you know, you can develop some eyes on what to look for. How to position yourself up for good outcomes. Okay, so that's one issue in the schools. They don't all teach the same curriculum. They don't all prepare the same. You're going to have teachers that are trying to help students along the way because they really want them to make it and complete their program and be a nurse, but they should not be in the program and they should not be a nurse. Okay, so while you have the public running saying, are you an RN, are you an RN, I need an RN, I need an RN. I took care of my father in his passing, and the majority of the nurses that came in were RNs. I vetted them all. And then at the end, I wrote the hospital CEO a detailed professional letter of which nurses on the 3rd floor of Centennial Hills Hospital in Las Vegas, Nevada, should be moved into positions of leadership because they did it well. I vetted the happy-go-lucky ones. I vetted the phlebotomist who came in and did not even know how to draw blood correctly and would cause my dad pain because they didn't even insert the needle correctly, nor did they choose the correct needle bore to use. So some of you are going to have to get off the idea that RNs are better nurses than LVNs. Just because they have an RN licensure don't mean squat. Do you hear me? I hope y'all hear me. And this is from a nurse who has the education of a RN, a LVN, a bachelor's degree level RN. I just hold the license of an LVN, but I took all 3 programs. I didn't finish the BSN program. I had 2 more semesters left, but it was all book work. It's all mind work. It's all critical thinking work. That's it. It's not a lot of hands-on, knowing how to make sure it's not a lot of hands-on. It's a lot of assessment. It's a lot of PowerPoints, presentations. It's a lot of professional development. So if you get an RN, this is a difference with RNs. You can have an RN that went from LVN to RN to BSN. That's one of the best nurses you could possibly have. One of the best you could have. They did the LVN, the RN, then they went to bachelor's. Best nurse you can have. Because in the LVN, she got all her skills down. Slap, she got them skills down. The RN, she got a little bit more of the critical thinking down. And by MSN, she ready to be a doctor. Okay. Then you have the RNs that go strictly, they don't even do the LVN program. They go strictly into the BSN program. When you go strictly into the BSN program and you didn't do the LVN, you skipped a whole bunch of your skills. You skipped a whole bunch of your skills. And like I said, my sister-in-law, she took one, she didn't get any IV skills. None. Okay? So for her school, they probably required her to actually be in the RN program before she got those skills. So she had to wait and get the RN skills. But for those that skip LVN and they go straight to if they go straight to RN and it's not a university, it's like a community college RN, you're good. You're good because they're still going to get the same thing that LVN got. They're still, if it's not university RN, if it's strictly community college RN program, they're getting all the good stuff. If they went straight LVN, they're getting some good stuff. That's if they got the training I got. Okay. If they went straight into BSN and they were not an LVN or RN, they just went straight into the BSN program, they missing a whole lot of skills. They're mostly book work. They're mostly professional development. Oh, shoot. My phone going dead, but I'm going to try to finish this. They're mostly professional. I might have to just pause. They're mostly professional development. Okay. So when you go to a hospital and you see an RN, just because it says RN don't mean nothing. You got to know which type of RN. Did you go straight university and didn't really get your skills down? Or did you go to the LVN, you did your skills and you got that on lock? Was it a good LVN? Did they teach you your IVs and your help locks too? And or did you just go straight RN through a community college? So that will give you an idea. So when I talk to nurses and I can see what route they took in their education, I know what type of nurse I got. I know who's taking care of me. So for the lie or the vision that the world has sold you that RNs are the best nurses, I am here to debunk that. So now you know. So as far as Pearson and me acting and helping with training the PAs, I asked one of the founders, I said, where are these PAs coming from? How? Because I noticed they were all doing different things and it wasn't consistent. And I was like, something not right. Then they tell me, well, you can be a PA. All you have to do is have a bachelor's in anything. I said, anything? Yeah. All you need is a bachelor's in anything. And you can apply for a PA, a physician's assistant education course, and we will teach you. But I had people coming in, PAs, who were not asking questions that they should have been asking, who were not doing assessments that they should have been doing, but they didn't know because some of them never even came from a medical background. And I said, well, what sense that make? They're not even from a medical background. You come in here just because you got a bachelor's and you want to jump in to be a PA, and you come in to do an assessment. Well, you come in to be a PA, physician assistant, but you've been all these years, you don't even know how to do a head to toe assessment. You haven't been doing them. Your eyes aren't even trained to automatically spot things that should automatically already be sticking to you. So you have this person who has a bachelor in being a math scientist. And now you come in here trying to deal with human bodies because they let you skip 4 years of medical education because you have a bachelor's. And now you're going to jump into the medical. And now you finna come do an assessment on me as a PA? And tell my doctor what? But see, I'm a nurse, so I know what LVNs and RNs, BSNs, I already know what they should be asking and doing and seeing. And so when I saw these differences, I had to ask. And the instructor, he said, oh yeah, you just have to have a bachelor's in anything. And then you come here and you sign up for our program and we teach you to be a physician's assistant. But you never even came from a medical background. That was so ludicrous to me. Absolutely ludicrous to me. And I'm like, okay, so for some of y'all, now you know this is being done in our country for sure. Anybody with a bachelor's can go to a specific type of program that are offered, and you can just become a physician's assistant. So you may see some weird things when you're out in doctor's offices and doctor visits. You may see weird things. All doctors are not medical doctors. Some are physician's assistants. Some are nurse practitioners. Now, I would accept a nurse practitioner over a physician's assistant because a nurse practitioner actually has years of practice of being an actual nurse with actual medical health science education. Okay? I will take a nurse practitioner over a physician's assistant. Do you hear me? So you might be confused thinking, I'm trusting my doctor. First of all, are they really a doctor? Are you dealing with a doctor? Are you dealing with a PA? Or are you dealing with nurse practitioner, NP? Who are you dealing with? Who are you dealing with? The thing you need to look at is the education. What line and mode did they come through to become a health professional? A health professional. Okay? And this is what I do every month or so. I go and I help the PAs as they go through their training to become PAs. And they come from different backgrounds that don't necessarily have to be medical professional. So when you're out in your doctor visits and understand who you're dealing with, what type of nurse you're dealing with, what type of doctor you're dealing with, what mode did they make it there through, how is their behavior, their natural behavior? Are they high-paced? Are they just cool and jokey? Are they very professional? And do they take their time with doing things? Do they listen to you? Do they make sure they have an understanding? Do they make sure that you are a part of the decisions you make about your health care? Are they trying to push procedures on you? Are they always pushing the same procedure on you? Are they telling you all the side effects and risks and adverse effects that could possibly take place? Have you done your research? Have you looked at these things? And we just had a big coup in Texas about 4 or 5 years ago where all the doctors across the state who had been being barred, having their license revoked, having remedial courses put on them, they found a loophole here in Texas. They found a loophole because Texas did not have a system set up to check the doctors if they had any prior allegations. Texas didn't have a system to check where they were coming from. So they would get their license taken, fly to Texas, start a practice here in Texas, start practicing in Texas to make their living. Even though the other states knew they did not need to be practicing as a doctor. You can Google that and you can look it up. This happened just 3-4 years ago. It was all over the news. And I haven't kept up. I need to find out if Texas has fixed that system, because they were trying to come up with this way to vet and say, okay, we need to scan these doctors and see, has any other state reported that, they had a violation? Okay. I get newsletters every quarter from the Texas Board of Nursing. I also get newsletters from the Nevada Board of Nursing. But the one that really gets me is the one in Texas. They'll send out this newsletter and it will have every nurse, RN and LVN, who lost their license, who had to go through remedial courses, whose license has been suspended. And it ain't just one little half of a page. It's not a half of a page. There are pages. I say about 4, 5, 6 pages every quarter of nurses in Texas who have lost their license, got remedial action, or been suspended. And it will tell why they got suspended or whatever. This is every quarter. Okay? And the only thing I can ask, because people practice outside of their scope of practice, but the only thing I can ask, I'll be wondering, where did they get their education from? How did they get into this? Is it just for the money because they wanted money? Or did they take this profession because they really have a heart of hospitality and compassion? Okay, so y'all need to just dismiss that bunk that RNs are the nurses to have. It is not so. There are many LVNs in hospitals as well. And I went to school with one girl who was an LVN. She was been an LVN for 10 years, and she was back in school to get her RN. And we actually went to UT together. And she was so confident. She was like, baby, please, I'll run circles around an RN. Because they have this blanketed perception that they can walk under and say, I'm an RN, because the world has set it up that way. The education system has set it up that way, even though the education system don't even teach the same things. And they letting people that ain't even from the medical field just come in on the tail end and say, I'm a PA. This is happening today. I just did a health acting course about 3 weeks ago. And we had this whole entire conversation with doctors and PAs. Real talk. So I'm here for consultation. If you need consultation about a medical procedure, healthcare, things you should do, things you shouldn't do, and I work with pediatric all the way to geriatric. I work with pediatrics. I have pediatric patients right now up the yin yang. Okay. And my geriatrics. My patients alone is geriatrics. But yeah, so it doesn't matter your age. I'm knowledgeable and experienced on all of these things. Like I said, I had a co-worker in the spa. She ended up with a bladder mesh. She's so distraught. She's doing all kind of therapies to deal with the fact that she trusted her doctor and she didn't get the information she wanted to. And most likely it was because there was money involved. There was an opportunity for experience to actually perform the procedure for a bladder mesh. It's experience for the doctor because they need these under their belt. So there are, there's other things you got to look at. People have agendas, personal agendas. They may be good agendas. I want to be a good doctor. I need to have experience in doing this particular procedure. I need to, it's going to help me get to where I want to be in my career. So when you're dealing with these people, it don't matter if you're a doctor. It don't matter if you're an RN. It don't matter if you're LVN. What's the motive behind the person? What kind of person are they? Why are they in that position? That's what you need to be looking at. Do you really want an RN? A clumsy one? Or do you want that LVN who is highly competent? Nurse. The differences between LVs and RNs, LVNs can only do a focused assessment, where RNs could do a comprehensive assessment. A focused assessment means if you come in pain, I have to ask you where's your pain, and you say it's in my leg. My focused assessment has to be only on your leg. All I can assess is your leg. A nurse can come, a RN can come in, she can do what's called a comprehensive assessment. That's a head to toe. She's going to assess everything, your musculoskeletal system, your neurological system, your integumentary system. She's going to do everything. Can an LVN do that? Yes, she can. Within scope of practice? No, she cannot. Within training? Yes, she can. Why? Because if you come in and say something's wrong with my skin, my integumentary system, I have to assess that. I can do a whole integrity assessment. If you come in and say my nerves, something is done with my muscular nervous system and my leg is numb, or my arm is numb, I have to just assess that arm. Can I do it? Yeah, I've been trained to do it. So all these assessments, they can do them all at the same time, but LVNs can only do one at a time. Does that sound stupid? It sounds real stupid. It don't even make sense. I can do all of them, but you just don't want me to do them all at the same time. Okay. That's not a big difference. Blood products. A RN has to be the one to connect and start the blood products, set the machine, have the product going. LVNs can't do that. After they set it, we can come and do whatever we need to do to the machine, we can do everything. Does that make sense? No, it don't make sense. Can we do it? Yeah, we can do it. Not a big difference. Care plans. A RN has to be the one to write the care plan, the initial care plan. You come into the hospital, you give us your chief complaint, we do a full assessment, we write together a care plan on how we're going to take care of you and get you better and up out of here, right? So the RN has to do that. After she does that, the LVN can come and change and do whatever she needs to do to that care plan. Okay, we're going to change this. Does that make sense to you? Can we do it within our scope of practice? No. Can we do it because we've been educated and know how? Yes, we can do it. We can do it. Write a whole care plan. I thought I had my Nanda. But yeah, yep. Pick lines. Pick lines. Any line that is going straight directly to your major arteries, whether it's in your chest, whether it's in your groin, in your arm. Pick lines. RNs are not allowed to do dressing changes on a pick line because that line goes directly into the heart or wherever it's going to. We can't expose infection that goes directly into a major organ or something like that. So the RN has to come in with her sterile supplies and do that and we bandage it. Can LVNs do that within our scope of practice by law? No. No. Not unless it's in a doctor's office. The doctor is there and the doctor requests that the LVN does it. Then we can go do that under the direction and guidance of our physician. Okay, so, but do I know how to do it? Yeah. I was at the hospital with my father, a RN who's a very good RN. Very good RN. She comes in, she's going to hook up my father's TPN. She opens up her sterile area. She puts her sterile area together. And she has one piece of equipment and she's holding it and she just don't know what to do with it. Because she don't want to make the wrong mistake. Once you mess up your sterile field, it's gone. You have to start over. You got to start over. She's holding and she's pausing. She's nervous because she knows, one, I'm watching and I've been vetting everybody. And I'm an LVN. But I liked her. And I saw that she was a good nurse. So I helped her. I said, just open the package and drop it out onto your sterile field. Yeah. Okay. And then when it came to insert into his port, she was nervous because it had a little needle. She didn't want to hurt him. And she was feeling around. But I'm an LVN. And I'm guiding the RN. And I'm telling the RN. But again, I'm not the average LVN. I've been to LVN school, RN, and BSN. But I can only practice as an LVN under the law, under my scope of practice as an LVN. And I'm comfortable with that because I know I'm good at what I do. Okay? I know what I'm looking at. So she was comfortable and she was better for it. She learned. She got stuck for a minute. And everything turned out good. Okay? So, again, you guys, don't be sold on the fact that RNs are the best nurses to have. There's not a lot of big differences between an LVN and an RN. There is not. And I just listed a few to you that are so stupid. And it's not big enough to put a difference between an RN and an LVN. It's just not the big enough difference. Okay, I don't mind if you do the bandage change for a sterile procedure. I'm not missing out on nothing. It's okay. I'm still doing trach. I'm suctioning people, respiratory. I'm feeding people through feeding tubes, hanging colostomy bags, patient teaching, refilling medications, talking to pharmacies, helping people to ambulate, do ADLs, activities of daily living, giving injections, Levonox injections, which is blood thinners, giving Lantus and insulin injections. Okay, there's not a big difference between LVNs and RNs. It's not. Though they would like to sell that to y'all, I'm telling you the differences. I just told you about the schools. I've told you about work facilities and people, good old boy systems. I've told you about personalities, postures, people's agendas, reasonings for why they take the careers they take. You seen I've watched them movies, Killer Nurses. You watch them, go Google it or TikTok it. Netflix it, Killer Nurses, Killer Doctors. It don't matter if you're RN or a doctor or LVN. It's about who's inside that body. How did they even get that RN? Were they even qualified, or did the teacher just let them pass? It's a whole lot of them. This teacher's just letting them pass. It's a whole lot of them facilities know they should have fired that nurse, but they got the good old system and they like them so much they let them keep their job. It's people out here that's leaving other parts of the country trying to find places to continue practicing medical procedures when they are not qualified. Look at the show Botched. Botched. I got a cousin who's an attorney right now suing somebody. A doctor who did a medical procedure on one of the housewives of Orange County and botched her up. The doctor done left the country. Do your homework. Do they actually have a license? Did they flee another state so that they can continue practicing being Killer Nurse Jackie and Killer Nurse Dr. Death? I'm telling y'all what I know. I'm telling y'all what I know. And I get these every quarter. TXBON send a newsletter. Nevada State Board of Nursing sends newsletters, and they keep us up to track on what's going on with us, each other, nurses and doctors. So I am Shema Ladd, licensed vocational nurse, giving you guys some insights on things you can look at and be mindful of when you're selecting medical professionals to care for you, medical positions, procedures, all that kind of stuff. Even with COVID vaccines, I traveled all over the state of Texas giving COVID vaccines to the mental and physical disabled people community. And I can tell you, I'm an LVN. I was the first nurse, not the first nurse, but one of the first responders to recognize what was going on with them vaccines, the differences. You know, because we had Moderna, we had Johnson & Johnson, and Pfizer, right? And we had hundreds of people coming through the line. We giving these vaccines. Well, I noticed with Johnson & Johnson, every time you get a vaccine, it's like as soon as you touch, blood starts running, but it's bright red, like a fresh cut. Like it's bright red and it's watery. Blood is not watery. I mean, it's it's liquid, but it's not, it's thick. And I was like, me and the other nurses started looking and talking. Every single person that got the Johnson & Johnson said the same thing. Ow, it burned. My arm hurt. Didn't none of the arm go numb. Who you think was the first people to notice that? Do you think it was the FDA and the people on TV that was going to air it on the news and tell y'all? It was the people giving it. And I'm not a researcher. I'm not here to tell the whole world, but I can see. I see what's going on. I saw how many people had adverse reactions that we had to administer epinephrine to and call the ambulance for. About how many out of 100 people did we have that happen to? You see what I'm saying? And so then, then we start giving them Moderna, and we're like, oh, well, the Moderna does this because everybody come through the line saying this. We knew before the whole world knew, because all the nurses, we sitting here giving it, trying to understand what we're doing and what we're giving, and we're watching what the side effects are. We're watching, and guess what? We calling our parents, don't take this one, take that one. Don't do this, do that. Don't da-da-da-da-da-da. And as a nurse, it's hard to do that because we're bound by law. And I said on another video, nurses are not allowed. Like, we can't start telling people, oh, when they come through the drive-thru, oh, you don't want the Johnson & Johnson. Your arm's going to go numb and it's going to hurt and your blood is going to come out looking like bright red and runny like we just gave you a blood thinner. Where by law, we can't say that. We can't tell you, we can't recommend to you specifically by name, oh, go to this doctor, go to that doctor. Oh, you don't want that doctor. Don't do that. How many times have you had a nurse talk to you in that fashion? 9 times out of 10, you're going to say never. Because we're not allowed to do it. We're not allowed to do it. We have to stay silent, support the healthcare system, support the doctors. the pharmacists, the drugs that the doctors are electing to use. And we make the wheels turn. So, again, I'm here as an advocate. I can't share PHI, personal health information. And I can't even recommend which nursing school you should go to or not go to, do or not do. I can tell you what I would do, what I did, what I would do differently if I had to, and give you some, consultation. So that's what I'm here for. There's so many things, I could coach you on or talk to you about. But I hope this information really opened your eyes, really took away some beliefs that will help you making better informed decisions about your health care. And even if you just were contemplating on going to school, if you were thinking about going to school for healthcare, to be a nurse, to be a doctor, hey, I just gave you some information on how to look for schools, how to choose the right program for you. Where are you trying to be in your career as a nurse or as a doctor? How far do you want to take this thing? So go through back and listen, and you'll hear me talk about the different avenues with some of the schools, and that will give you an idea on what you need to be looking for and what questions you need to be asking when you're looking for a health science school, a health science training. Okay, so I hope that's enough for you guys. Like, subscribe, share this video. I love you guys. And this is Nurse Shema, your personal development and premarital life coach. And until next time, see you later.